Good morning, everyone. Welcome to our panel discussion here today. We're going to get started momentarily. Good morning, everyone. Welcome. My name is Tiffany Tauschak, and I'm the president and CEO of the Greater Des Moines Partnership. We really appreciate you taking time to start your day with us. We are excited because today we are hosting our third event in the Economic Outlook webinar series, and today's event is focused on the state of healthcare. We understand, of course, how important it is to our investors and our affiliates to hear from industry experts on how they're navigating timely and sector-specific topics. So during this four-part series, we are joined by leaders in some of our region's key industries to hear from them on how they're navigating the economy and preparing for the future. Today, we're joined by a panel of industry leaders in healthcare. And before we begin, I just want to make sure to note that this is an invite-only virtual event that's open exclusively to Greater Des Moines Partnership investors and affiliates. Also, this conversation is considered off the record, so the use of AI note-taking or other transcription tools is prohibited. Thank you for your help and cooperation on that. Now, I'm excited to introduce to you our panelists who have a wide range of topics to cover with us today in the brief time that we have together. Joining us today are Vanessa Freitag, COO of MercyOne, John Rosenfeld, Market President of Unity Point Health Des Moines, and Ben Vallier, CEO of the Iowa Clinic PC. So I'm going to start off with just a few questions of our panelists. But as you all know, as attendees, you are welcome to drop some questions into the chat box, and we'll get those questions answered as we can throughout our time together today. So we'll start with our panelists giving just a brief introduction of themselves, as well as a major trend that's shaping healthcare right now. So we're going to start with Vanessa. Welcome, Vanessa.
Yeah, good morning. Thanks for the invite to participate. So I'm Vanessa Freitag. I'm the Chief Operating Officer of MercyOne Des Moines Market. While I've been in healthcare for about 30 years, I have joined the MercyOne team as of April 2024. I am a native of Iowa, originally from Waterloo. So it was wonderful to move back to this great state, and I'm happy to be part of the Des Moines community. MercyOne, I think many people know, is comprised of 21 owned and 23 affiliated hospitals, largely covering the greater Iowa area. Certainly, Des Moines is host to the MercyOne Des Moines Medical Center and MercyOne West Des Moines campus. Happy to be here.
Very good. Thanks, Vanessa. Welcome. John.
Hi, good morning. Pleased to be here. John Rosenfeld, Market President, Unity Point Health Des Moines. Not too dissimilar from Vanessa. I've been in healthcare about 30 plus years and new to Des Moines, new to Unity Point Health, about 19 months now. Very glad to be part of the Des Moines community. Unity Point Health is made up of 8 markets, primarily in Iowa, with some presence in Illinois and a market in Wisconsin as well. And pleased to be here and answer any questions that there are.
Excellent. Thank you. Glad to have you both here. And Ben.
Hi, good morning. Ben Vallier, CEO of the Iowa Clinic. We are a physician-owned multi-specialty medical group with 50 medical and surgical subspecialties and a variety of other outpatient services that we provide in partnership with both health systems. And excited to be here. This is my 5th year in Des Moines, and I absolutely love Des Moines. I think we are a hidden gem in the Midwest.
Very good. Thank you. Well, we're so glad you're all in our community, and we hope to make this not a hidden gem, but a very well-known gem to help attract more talent and more business here to our region. And we're able to do that in part because of our great healthcare providers and options that we have in our community. So thanks for all you do. And I would ask first question here, as you're looking out ahead 5 years, what do you see as some of the biggest challenges and biggest opportunities? So, John, we'll start with you.
Sure. So, as we talk about Des Moines, I think one of the great things about Des Moines is it's a growing community. And so how do we meet the growing needs of our community? So, it's a wonderful time, as we talk about. So our labor challenges cost of supplies, cost of technology, cost of labor increases. So how do we continue to be the provider of healthcare in our community that's growing at a time when our costs are escalating, but our reimbursement is flat or decreasing? So the challenge is, how do we do that? So we have to look at technology and how do we supplement people with technology to continue to provide care, continue to provide value to our community and our business leaders. And to me, that's the biggest opportunity and challenge, is how to do that. So it's wonderful, we're growing, but with that growth comes its challenges as well.
Thank you. Ben, same question.
Yeah, so I'd maybe say that something similar, a little bit differently. I think we have a crisis in Iowa of both affordability and access. So we're 44th in the nation for the number of physicians per 1,000 people. The average family's healthcare premiums have gone up 40 to 50% in the last 10 or 15 years. Yet we're 29th in the country for our overall healthcare outcomes. And so I think that leads to an opportunity, which is, how do we work differently with all the people that have to underwrite these costs and have to support the healthcare of their employees, the people on calls like this, our business community? How do we work differently to try to disrupt what has been a really indisruptible system of what I like to call the healthcare industrial complex?
Thank you, Ben. Vanessa.
Yes, thank you. I'd like to add on to what John and Ben spoke to start. Really, when I looked to relocate back to Iowa after living outside of the state for 40 years, I did some statistical checking online, and don't fact check me on this. It's just top of mind what I recall. But what I recalled is that the state of Iowa itself, from a population growth standpoint, is maybe growing at about 0.4%, give or take. But Des Moines communities are growing 1.1%. So that was telling me that, there is a challenge in rural communities in Iowa, and particularly when it comes to healthcare. And so what I've observed is, a high demand of healthcare in the Des Moines communities. That exists today, and that is going to exist into the future. But it is very important that we also create a model to sustain the rural communities. It's access to healthcare, access to education, those types of components that will really allow a rural area to thrive. What I also looked at was some of the workforce challenges. So coupling that with our population projections, we also know the workforce shortages are real. They exist today. We don't see a clear and evident path of being able to meet all the healthcare needs within the state just by recruiting from within the state. So it is going to require that we really look, across the country and internationally as well, for our workforce needs into the future. I think leveraging new partnerships, top class service models really is at the forefront for how healthcare is going to evolve over the coming years, and that just creates a number of opportunities for seamless experiences to the consumer. Thank you.
Thank you. And so the Greater Des Moines Partnership, we represent 12 counties, and very much appreciate the comments about the population growth. Our region is continuing to grow, and yes, we still remain very focused on how do we help the state continue to grow. So that's something Partnership continues to work on through our talent attraction initiatives as well. So appreciate those thoughts and comments. So one thing that we've heard from many leaders as we've been out and about and continuing to meet with our investors and have panel discussions is related to AI, opportunities and challenges. So as you think about AI, how is AI changing, or is it your workplace and industry overall? And for this one, we'll start with Ben.
Well, so the first thing that comes to mind is the way the insurance companies have used AI to deny our claims. But I think within the provider community, where we see AI having the most immediate impact is really in the back office and automating some of the laborious tasks of putting semicolons and periods and all the different things that we have to do to keep up with either regulatory things or billing type work. I think it will move thereafter pretty quickly into the clinical space, where I think it'll probably augment clinical judgment to some degree. What I think we want to be careful with there is that we don't take anything away from the humanization, the human impact of what we do, and dilute any of the compassion that's really important for us to show in the care experience.
Thank you. Vanessa.
Great question. AI is definitely influencing all of our lives, not only as the healthcare industry, but certainly as consumers as well. Really, from all aspects of care delivery, I see how consumers interact with healthcare, how clinicians provide care. You take anything from how we schedule appointments, how we complete consults, how we do procedures is changing because of AI. Access to health records is certainly a win, particularly for consumers. We look at our operations, supply chain, clinical decision support. Really, it is endless for the opportunities we are starting to see AI integrate into our healthcare sector. Really, it's a tool that can augment our work. It's letting technology help us be more efficient. So I'm looking to the evolution of AI in healthcare.
Thank you, John.
Yeah, and so I'll add to that. So, one of the things that we're using today is more on the ambient listening spectrum. So, when we introduced electronic health records, one of the feedback we got from our patients was the docs are at the computer, looking at the computer and not engaging us in dialogue. So AI has really helped that in that it is in the background, it's listening to the conversation, it's creating the doctor notes, which is allowing the physicians to be present in front of the patient. So ambient listening has been a wonderful addition to our clinic physicians who are using it to make sure that they are really truly engaged in that. There are other aspects to the business. We're starting to use AI as it relates to post-op calls. How was your experience? Do you have the medications you need? Med reconciliation, and we're starting to use AI to help at discharge med reconciliation. So as we go back to the first question, one of our challenges, labor. So AI is taking on some of these things that we've been dependent on, scribes and other roles, and now can be done at AI and still create, as Ben said, that humanistic approach to patient care.
Thank you. And related to patient care and patient expectations, how are you seeing patient expectations evolve and change? And how are you responding to some of those changes in expectations? So Vanessa, let's start with you.
Thanks, Tiffany. I really look at this from the lens of, even those of us that work in healthcare, we are all patients, and we are all consumers as well. And the things that we value in various industries are true for healthcare as well. So we think of where we gravitate to as consumers. We want timeliness, we want efficiency, we want access, we want things to be very easy. And healthcare continues to evolve in that capacity. We have a long way to go, but recently, at least speaking for Mercy One, getting aligned to a common electronic health record across all of our access points is a major step towards addressing that timely, efficient access to care. It's leveraging tools in how we communicate with our patients as well. So what used to require, phone calls are now being much more efficiently managed through messaging, which is an example of what consumers are gravitating to in 2025.
Great point. John.
Yeah, so I agree with Vanessa on all that. I'm going to take a slightly different approach to this question a little bit, but I would say the use of social media has changed the kind of that expectation, like in many businesses. So people are putting online their good experiences, but also their bad experiences, and that is setting consumer expectation as it relates to care. We just got a Google review from a patient, a family member who said, your waits, we're hearing your waits are in the ED are extremely long. You're not providing care you're not providing good care to your community. This isn't a patient who arrived at our ED, needed care, or had a bad experience. It was just the anticipation. If I need to come to your ED, you're going to make me wait for a few hours before we can get the appropriate care. So I think social media is playing a role. I think people are trying to start using, well, they are using the internet to self-diagnose. And so they're coming to their appointments with some ideas of what they might have, which is shaping how interaction with physicians, things of that nature. So the use of social media, internet has changed the dynamics in terms of that expectation when they come for their medical appointment.
Thank you. Ben?
Totally agree with all that. I think our industry is sort of woefully behind. We have a ton of technology in healthcare. It's just technology people don't see and experience. You know, it's in the OR, it's in the imaging areas. We have a lot of technology, but the customer-facing technology and those processes in our industry is really far behind, I think, many other industries for a whole bunch of reasons. And so I think all of us are sort of scrambling to try to keep up with the customer expectations relative to the regulatory burden and to just the legacy systems that we all have to deal with in our business.
Thank you. I'll pause here just to remind our attendees that if you have questions, you're welcome to drop them into the chat, and we'll get to those as we're able, working our way through the panel discussion today. So next question is, as you think about labor and workforce, which you all touched on already today, what are some effective ways that you've seen or experiencing putting into place to attract and retain workers in the healthcare industry? So for this one, let's start with Vanessa.
Thank you, Tiffany. I mentioned at one of the earlier questions that we've acknowledged the workforce supply within Iowa is we're not going to be able to graduate enough healthcare workers to meet the demand. That is requiring that we look to novel ways, maybe that we haven't tapped into before, to really fill that need. And I think this is in alignment with what we see with the DSM partnership as well, in that we are looking to the international workforce in healthcare, recognizing that the shortfall exists. Even across the U.S., it requires that we think differently. This allows us to embrace diversity. We've identified some very good programs to partner with to help us fill that gap. And we have identified some very strong candidates to hire as permanent workforce. So that is not temporary workforce, that is actually permanent workforce that we will help get to the U.S. To really start to diversify our colleague workforce and fill a much needed healthcare gap. So I'm just sharing one example of a novel way. Other ways of attraction, certainly early exposure. The sooner we can get to students, even at a younger age, to really share that information about what healthcare careers look like. We invest in jumpstart programs where we can get some commitment to healthcare and then help those individuals navigate, through their curriculum to be trained and ultimately hire them into the workforce. Also, looking at variable employment and contracted models. I know there are, everyone is looking for a little bit something different. Healthcare is 24/7. That is all sometimes a deterrent from becoming a member of the healthcare workforce, because there are needs on evenings and nights and on weekends. And a lot of times that doesn't fit with what individuals are looking for from a lifestyle balance. So we're still trying to figure this one out. I think it likely includes a blend of options, to fit the lifestyle and the individuals.
Mm-hmm. Thank you. John.
Yeah. So, I think the question was, how do you retain, attract people? And I think it's a lot about the culture of your organization. Creating a culture that people want to be a part of, a culture that's inclusive, a culture that allows people to have a voice in appropriate decision making. So I would say it goes back to what is the culture you want to create. We're in healthcare, as Vanessa said. We want to make sure that people are coming and able to focus on the care they're providing to the patient and not all these other things that sometimes consume us all. So I would say the growth mindset, people come to your organization and feel, as Vanessa said, they can grow within your organization. So you give them opportunities through career pathways to develop themselves as individuals. And We just celebrated the 50th anniversary of a team member who started, and has been able to grow at her entire career in the organization. So I would say those are part of the things that you want to create as an organization to allow people to thrive and be excited about being part of your organization.
Excellent points. Ben.
I think I agree with John. It's about culture, and for us, we want to differentiate our culture. We're a smaller employer in the healthcare world, at least, and so we want to attract people to do something a little bit different. And so we have this very anti-bureaucracy thing we do here, where we try to tell our staff, "Hey, we are not going to tolerate bureaucracy in our organization. We are in a highly regulated environment. Yes, yeah, we have to do things right, but we are not going to tolerate bureaucracy." And in that way, we try to keep them a little bit closer to the care and have a little bit more of a voice in the things that happen, so that they're not victimized by what we're doing to them. Rather, it's what we're doing together to take care of patients and meet our community healthcare mission.
Thank you. Thanks, everyone. Also, just a shout out. Thank you for the programming that you're putting in place and supporting for getting to that younger generation. Really have heard more and more great things about some of the work, even with seventh, eighth graders that you're all doing. So thank you very much for that work. That's something the partnership really believes in as well, is helping build that talent pipeline, helping those future workforce understand the great opportunities here in our region. So we do have several questions coming in. I'm going to start with a question from Partnership past board chair, David Stark. Thanks for joining us today, David. So his question is, how are you dealing with some of the non-traditional competitors? And do you see other competitors coming into the market? So for this one, let's start with you, John.
Sure. Thanks, Dave. Yeah, I mean, there are different people, right? So you've seen the Amazons of the world and others wanting to get into healthcare, and so they invest a lot of money into urgent care models that they believe can provide superior care. You have people like Oak Park, which specializes just on the Medicare population and feeling they can do that. And what we've seen is healthcare's hard, and so some of these players who've tried to come into the market, not just Iowa, Des Moines, but other markets nationally, have left because opening up urgent care in a supermarket hasn't really necessarily materialized in the way that people expected, right? So, Vanessa talked about EHR. You go to any Mercy One shop, all your notes are within the same EHR. You don't have that when you start fragmenting care. So I'd say that's the biggest challenge. You're starting to fragment care by doing that. So, you have people coming in, opening up ambulatory surgery centers and single specialty urgent care centers where they can cherry pick some of the patients out of our healthcare system, which then creates challenges for us. So there is a model for that. Some of them has been successful. Others really have not materialized to the extent that they thought because of the challenges in providing healthcare services.
Thank you, Ben.
So I think I would agree with everything John just said. I think we've seen some success with some of those folks. They kind of, they'll take the pink eye or the earache or the cough, and they'll try to virtualize that to, somewhere in another state over a phone app. And some of those things are very nice features for patients, and insurance companies certainly like that, but it does fragment care. And I think ultimately the relationship between a provider and a patient is the thing that will drive better health outcomes longitudinally. And so I welcome those competitors. Come on in. There's lots of patients. 40% of Iowans live in health shortage areas. If they want to come in and try to do healthcare in Des Moines and Iowa, the water's a little cold, but come on in.
Vanessa.
Yeah, thank you. Definitely agree with what John and Ben shared as well. I welcome the novelty, in the introduction of new competitors and new ways of providing healthcare. That is how we are going to continue to push ourselves, be nimble, be creative, not just always responding to the market dynamics, but trying to plan ahead for where the shift in consumer needs are. I think healthcare is likely to evolve, over the next 10 to 20 years. It will probably look a lot different. I reflected on the experience that we had during the pandemic. And because of the situation, we were forced to fast track many ways into virtual technologies to leverage access to healthcare. It was just a situation. And I think at that time we might have seen an uptick, anywhere from 1% that were using virtual platforms to get access to their care, increased to 30% during the pandemic. So it definitely fit a need. Since that time, I think the numbers are closer to maybe 15 to 20%. So it's telling me that that model of access, while it fit the need at the time, it really hasn't taken a hold for the mainstream consumer just yet. But as new entrants come to the market and we continue to learn from those types of models, certainly that is something that will be of value in the future as that continues to evolve. So it's about being ready to project, being ready to respond, make the changes, see where things land, pivot and adjust, really trying to meet the consumers where they want to be met to stay ahead in this healthcare environment.
Thank you. We have another question from one of our attendees, Sherry Nelson with Easter Seals. Thanks for being here, Sherry. She says, first of all, thank you for your service. Your work is hard and so important to our community. What impact do you believe HR 1 or the Big Beautiful Bill will have on your organization's ability to serve the community, and how do you anticipate responding? So with this, let's start with Ben.
The Big Beautiful Bill. Well, there's a lot in there, so that's not a short question to answer. I'll start with something positive. There's some provisions that I think will allow us to provide primary care a little bit differently from a business to business setting, which is something we're really focused on and trying to create novel kinds of access. So I think there's some provisions there. There's some reimbursement things that are going to create a lot of different disruptions that I think we're all still untangling. And there's probably a list of 8 or 10 other things that we could talk about, but those are the two I would highlight.
Thank you. Vanessa.
Yes, thank you. Agree with Ben's response as well. I think there's a lot of unpacking to do yet in this bill, particularly the impact for the state of Iowa. We know certainly it's creating some headwinds that we're going to have to navigate against. Challenges within the payer environment are not new to healthcare. That's something, we have battled as long as I have been in healthcare. But this does create a new dynamic that we will have to find, completely understand what the impact is to the population that we're serving. We have a fairly high Medicaid population that we serve here in Des Moines and across the state. There is some impact there that will shift the way that we're able to provide the care and the reimbursement models that have traditionally helped fund particularly not-for-profit healthcare. So we are waiting to see how all of this shakes out across Iowa, and are actively making plans to pivot where we need to.
Thank you. John.
Yeah, so what we do know pretty clearly is health systems like ours will get less money, right? So our margins are already thin, and we know we are going to get less money out of this. So based on all of our discussion today is how do we provide care differently? How do we provide care more effectively at a lower cost? Because that is the only way we're going to be successful. So as Vanessa said, we have people, population with Medicaid, we are going to get paid less. As it is today, we're not covering our cost. We are going to have people coming off the Medicaid rolls and going to self-pay. So I think it's going to behoove all of us to make sure that we, again, spend time. We have time. Many of these things don't go into effect till 2028. So we need to be planful, make sure that we are continue to be in our community providing care, but we are going to have to work smarter and differently to continue to provide the full spectrum of care that this community has expected of all three of us on this call.
Thank you. Very dynamic and evolving situation. So appreciate your continued leadership and proactive management of controlling what you can control in this situation. We do have another question. This one is from Emily Shearer from the Food Bank of Iowa. Thanks for being here, Emily. Can you comment on the importance of programs like SNAP and WIC in our state? and helping to reduce the number of patients seen or having to be seen due to recurring problems that could be solved with better nutrition and resources. So, John, let's start with you.
I will start. I don't know very much about this program, so it really would be very hard for me to respond to that.
Okay, Ben or Vanessa, can you respond?
We know healthcare and health generally starts with good nutrition, and we know we've got a myriad of struggles with that around our state. And so I want to say thank you to the Food Bank of Iowa and all the folks that work together in our community to create some of the nutrition safety net. And we know we have a long way to go on that.
And I would, also acknowledge that poor nutrition and access to food provisions, access to healthcare, as we've already described, really are what help keep individuals healthy and out of the acute care space. We would prefer to keep patients in what we would call an ambulatory space where you can interact with healthcare before something becomes a true problem. Nutrition certainly is one of those access necessities, a foundational element for all humans. So definitely want to appreciate what the food bank does to support that. Specifically, I don't have anything to add relative to the question. I do just want to acknowledge that it is a very important part of keeping patients and keeping consumers, keeping the public healthy.
Thank you. And just a note that the partnership, which produces the Downtown Farmers Market, which happens every Saturday, May through October, we do accept SNAP at the farmers market. Many vendors do. So that's another way to get access to additional fresh produce at the market from farmers from around the state. So thanks for the question. We have another question here from Allison Peterson. A large barrier is the process in which individuals interested in pursuing a healthcare career have to endure just to be accepted into a postgraduate school. Have you considered offering education and training opportunities to the public or your employees who wish to further their education? So let's see, Vanessa, let's start with you.
Thank you. And I do want to acknowledge we're fortunate that we have our relationship with Mercy College. So it is a primary component of our, annual strategic plan, annual operating plan to really look at what the workforce needs are within healthcare and work very collaboratively with the college to intentionally plan where we're going to put resources and spend time. I think when we talk about particularly the role of the private sector and the public sector within Des Moines, we look towards how we are all working together to make sure that we have the workforce needs into the future. We are doing a major investment in Mercy College, particularly around the nursing school, really with that emphasis of not only attracting individuals, from the greater Des Moines community, but certainly around Iowa that we would look to retain within the state of Iowa for healthcare purposes.
Thank you. John.
Sure. I think you heard from all three of us. We do feel it's part of our obligation to help train that next level of healthcare providers because of the critical need in our community. So, I think there's a lot we all do, and I can talk about what we do at Unity Point Health. So we certainly have tuition assistance, so people can start an organization and get accepted into any program, and there is tuition assistance. We have a Pathways program where our team members tell us, I want to advance myself, but I'm dependent on my salary. So if they are accepted into this program, we keep them whole from a salary perspective, but allow them to go to school and advance themselves. Through our foundation, we give grants and things of that nature to students who are in programs. Tiffany, I think you mentioned something that, at UniPoint, we do something called nursing camp, where we bring in students in middle school, and they come and they start learning about healthcare even at an early age. And so you can never start too soon to get people interested in a career in healthcare. And I think we all do things that encourage folks to pursue careers in education. And I think there are nice funding sources to allow people to come to work and identify where they want to be and help them get on their journey.
Thank you. Ben.
Yeah, so very much something that we all have to contribute to. Right now in the building I'm sitting in, I don't know how many students there are rotating, either PA students, pharmacists from Drake, residents that we partner with UD Point, or University of Iowa, or podiatric students from DMU. Like we have our own CMA program, so we all try to take kind of our own little contribution to this. I think healthcare feels that burden, particularly because of our own needs, but also I think we just feel a calling to that because we have so many folks that have such advanced education in healthcare, and they have a desire to pass that along. So yeah, big challenge, and hopefully we're all doing what we can to contribute to it.
Thank you. Well, I'm going to shift directions here just briefly here. We have less than 10 minutes left together. So curious if each of you would be willing to share a leadership lesson that you have learned from, grown from, that you'd be willing to share with us today. So let's start with you, Ben.
I think for me, it's not waiting for perfect information, understanding that when times are volatile, your people need from you a decision, oftentimes with imperfect information, and not being too afraid to make a mistake and willingness to put your foot out there and do something bold.
Thank you. John.
Sure. I would say two things come to mind. One, the ability to listen to your leaders and your team members, right? So as we talk about change, we need the support of everyone in the organization, and we need to listen. Our frontline workers know their work the best, and as we look to them to help us identify opportunities for improvement, they're the ones closest to the work. So include your team members in decision making. And the other thing is, the one thing we talk about all the time is in healthcare, the only constant is change. So the ability to manage through change and make sure that you and your leader and your teams can effectively manage change will serve your organization well.
Thank you. Vanessa.
Yeah, I second those thoughts. Leadership lessons, I always keep in the back of my mind, analyze and adapt. We're perpetually in a state of having to look at what we're dealing with today, what might be coming, in the future, looking at where we've been, analyzing and then adapting with rapid intention. It's being nimble, it's being creative. Healthcare as an industry probably doesn't, if you look at personality types that tend to, join healthcare, it's probably not made up of largely creative people, but it's up to us as leaders to do exactly what John said, and that is get in and learn from the front line. That is where the ideas are going to come from. That is where the barriers are going to come to light. And then, it's our job to help break down those barriers and navigate through changes that are going to make the colleague or the workforce life, work-life balance and work experience more enjoyable, more efficient. So being nimble, creative, adjusting, pivoting, being in a state of constant change.
All right, I'm going to ask you each to brag about yourselves and your team just for a moment here. Please share with us a decision that you've made recently that has had a significant positive impact on your team and organization. And Ben, let's start with you.
I don't know, I've got a lot of bad ones I've made. We don't want to do those, I guess, today, but I think we've really tried to double down on what I talked about at the beginning of addressing the issue of affordability. And so we've said we are not going to be smiling at our partners in the community while taking dollars out of their back pocket. We're going to work on creating value together. And so we've started a number of partnerships with local businesses that I think have been some of the more rewarding work we've been able to do because we can see lowering cost, improving quality, and impacting our local partners in that way.
Thank you. Vanessa.
So I can't think of one specific decision, that shifted our system significantly. I think of, the complement of several decision points that have required multidiscipline participants to be at the table to help identify, what the opportunities are, what the pathway is to see some changes through. We're continuing to invest in program development, clinical program development, right now really focused in on medical oncology and, inclusivity into the Richard Deming Cancer Center that will, modify how we are providing services in that space to meet the needs of consumers in Central Iowa. Investing in a fifth robot technology to meet the surgical demands. Again, as we talked earlier, consumers really want care to be, high quality, have quick recovery, have low complication rates, and surgeons certainly want to be very efficient in how they are providing those services. So making capital investments where we can to continue to advance care in the area. Looking at how our partnerships and joint ventures operate, knowing that the healthcare dynamic, the market is going to continue to shift, and we will, continually look at how we can meet payer and consumer demand for lower cost models, looking at convenient models, and really think differently about alternative revenue sources.
John.
Sure. So in January of this year, UniPoint Health rolled out a new strategy, and it's called Exceptional Experience. And it's an exceptional experience for our patients, our team members, and our community. And while it sounds simplistic, it is intentional to make sure that everyone who's part of UniPoint Health knows what their role is, and their role is to create an exceptional experience. And it's just not about talking about it. It is looking at every process in our organization with the lens of how do we do something different, with the lens of creating an exceptional experience, whether it's for our patients, whether it's for our team members. So we've gotten hundreds of team members together and saying, walk us through the process. How do we do this in a way, from your perspective, creates an exceptional experience? So we talk about retaining and recruiting new team members. We talk about creating a good environment for our patients. So that's something that's very exciting for our organization. And obviously it will take us time, but we're committed to that exceptional experience.
Thank you all. Thank you for your great comments, for your honest and candid dialogue today. Really appreciate it. I know there are several other questions that came in. I'm sorry that we don't have time to get to all of those. Our time together goes so quickly, and it's in part because of the great wisdom and experience that you are all sharing with us today. So really appreciate all that you're navigating in this continuing, dynamic, changing, evolving landscape as you look to continue to take care of our community and communities surrounding us as well. So thank you, Vanessa, John, Ben. Thank you for the insightful discussion today. We really appreciate the opportunity to learn from you. For all of our attendees that are listening, please save the date. We have another webinar series panel discussion set for Tuesday, August 26th, and it is focused on the state of ag innovation. So that event will feature Jason Andringa, President and CEO of Vermeer Corporation, Lane Arthur, VP Precision Technologies at John Deere, and Jeremy Dirks, President, North America Business at Corteva Agriscience. So thanks again to our panelists, and thanks everyone for joining us today. Have a great one.
Thank you.
Thank you, Tiffany. Bye-bye.
Bye.
Bye.